now. But please, do you mind if you go to our YouTube page?
Yes, I am on it.
Okay. What does it show? Oh,
Nothing.
oh, I can hear myself.
No, let me mute.
Oh, I see. Is it live?
Yeah, it's live now.
No,
Oh,
no, I was looking on YouTube trying to figure out where the live stream part is. Do you go to the live section?
So how do we know when it's live on YouTube?
Oh, create.
it's
Go,
right. It's currently live on YouTube.
Oh, okay.
create, go live. Yeah.
Okay, great. So
Yeah,
it
I
is
see it.
live on YouTube, Facebook.
Did you see it?
Mm-mm.
So
So let me share my screen.
you go here. Oh, sorry.
Do you see my screen?
Mm.
See, this is it for girls, and so anyone that goes through our link, like share the live, they can have access to it.
Because I need to enable like share the live or something. Oh,
No, it's already on. It's live now. We're
I see.
all live.
Great.
How do I get
Perfect.
out of this?
Okay, so let me do the Facebook one.
We can leave it live till it starts, right?
Yeah. Oh, okay. Stop live streaming. Let's see. Facebook.
Good afternoon, Mom.
Oh, hi, Latif. Good afternoon.
In future, I think you go YouTube Studio.
And then for spotlights, you can probably put Dr. Julius for spotlight. So to spotlight somebody, you just like there's let me see if I can show my screen.
Oh, there it is.
Okay, so you just right click on my, like for example, you can right click on either my name and then just it should have like pin. So you pin my stuff. So once you pin me, I'll be on big screen.
Okay.
Yeah, so you just pin yourself, Dr. Actually, let me pin you now. Okay, and then you pin Dr. Juliet and Dr. Millie.
Okay.
Yeah. And then let me give you back host. Okay, so you're host now.
Okay.
Am I a
So
co-host so I can do
You're
the
not-
screen sharing portion?
I'll let you share screen.
You're not Ekene, you're not connected.
She's not. Are you not on?
Oh yeah, I went
Okay.
off, so
Okay. When she logs
sounds-
back in, I'll be able to I'll just enable for her to share her screen. I think that should work, right?
Yeah, that should work. So both you and Ekene, your co-host. So if Ekene logs in with the Slow Zoom, then you would like automatically be co-host.
Okay.
All right. Thank you so much. I have to go. Just
Right.
please text me if anything.
So everything is live now. We don't have to do anything regarding live. We just start off.
Yeah. The YouTube one, I need to check out the YouTube. But yeah, sorry, not the YouTube, the Facebook. YouTube is live.
Okay.
Like if you see if you look at the pin on the left, it says live.
Mm.
And they can always if you click on the YouTube, it will take you to the link where it's live.
Okay, I can see it saying live for YouTube,
Exactly.
but nothing on Facebook though. I guess
Yeah.
that will appear.
Yeah. All right. Thank you so much.
All right, thank
Bye.
you.
Thank you, Chisom. Yeah, I don't see
I don't know.
I don't see Facebook, but
I don't know how to do it, Jerry.
so we can go ahead and pin Dr. Juliet,
Yeah.
and then so you don't have to think about it.
And then
You pin yourself. Well, I think maybe you already pinned.
I think I'm admin.
Good morning. Can you guys hear me well?
Yes, we
Yes, we
can.
can hear you.
No problem. So I'm just here. I just wanted to make sure everything is working on my end. And I'll
Yeah.
stay in the background.
Um,
Okay.
No, she looks so cute.
Hi, everyone. Welcome. Thank you for joining us. We'll be starting very soon. Let's just give a minute or two so others can join us.
The Independent National Electoral Commission, INEC, in Oyo State, has commented the distribution of sensitive materials ahead of Saturday's general elections. The distribution of the sensitive materials to all 33 local government areas was done in the early hours of today. This when reported to polling centers.
Welcome. Thank you for joining us. We'll be starting soon. We're just giving people a couple of minutes. Hey, welcome. Thank you everyone for joining us today. We are so glad to have you here with us. Good afternoon, good evening, wherever you're joining us from. Hope you're having a good day so far. So I would like to start off with introducing myself, and then I'll go on to introduce our panelists for today. So I'm Dr. Obiona Ifeoma, and a public health physician in Nigeria, and currently working on my PhD in public health. I have a lot of passion for public health, young women, and health promotion. And we have our two lovely panelists, distinguished ladies who have done a lot of work in promoting healthcare nationally in Nigeria and internationally. And we are going to be here to discuss about cervical cancer, the For Girls and Women's program, and take questions and answers. So I'll start with introducing our panelists. First, I'll start with Dr. Kiki Omeli. She obtained a medical degree from the College of Medicine at the University of Lagos, and she ventured out of medicine and is an award-winning Nollywood actress and movie producer. Kiki is passionate about women's health and youth advocacy, particularly through media and public awareness. So it's very natural that we have her here, and we thought of her to create awareness around cervical cancer and the ongoing For Girls and Women contest. So Kiki is here today. Welcome, Kiki. All right, and we also have Dr. Juliet, Professor Juliet. She's a professor in global health in the Department of Behavioral Health Science and Health Education at St. Louis University. Her research is centered around the use of culturally salient implementation science strategies to develop, implement, and sustain in community settings, and using evidence-based interventions that reduce health disparities and advance health equity. All right, so we're lucky to have both of them today, and we're going to all learn so much from them, and we're looking forward to it. All right, so I'll start off by introducing the For Girls and Women. Now, we are a team of individuals, researchers, community activists, girls and women, and we're all united with a common goal, which is to eliminate cervical cancer in Nigeria and globally. We have our website, and we'll share that on the screen. for you to see, and you can go through, visit, learn more about us and the work we are doing. The website will also be included in the chat, so you can click on that and you can go visit. All right, so let's get into why we're all here today. Very exciting. We're here to discuss the program. Basically, we believe that women and girls can be empowered to end cervical cancer globally. It's one of the second most common cancers among women in Africa, and it kills a lot of women and girls on a daily basis. So we seek fresh and dynamic voices and experiences of mothers, including caregivers and daughters, to collaborate as a team to identify ways to promote HPV vaccination for girls and HPV screening for women. We believe that girls and women hold a mirror to our society and can challenge the conventional exceptions about ways to end cervical cancer. All right, and then it's also good to know that by joining For Girls and Women, you have the opportunity to make an impact on your community in a tangible way and in a positive way. And you're going to help to solve one of the major global public health problems. So this is a problem globally and in Nigeria. And you're going to help girls and women have access to HPV vaccination and screening services. And you're going to be able to connect to a worldwide network of mentors and leaders in public health, like the two wonderful ladies we have here today. And you're going to connect with like-minded women and girls from your community. And of course, you're going to develop lots of skills, such as leadership skills, problem-solving skills, community engagement skills, and research, and lots more. All right, so let's go on to the two ladies we're here to meet with today. And to begin, I'll be asking both Dr. Melly and Dr. Juliet one word to describe cervical cancer.
Kiki, if you want to go.
Hi. Okay, so for me, I would want to use a phrase. I would like to call it a preventable scourge. That is how I would like to describe cervical cancer. Yeah.
Okay, thank you.
My own will be invisible. The fact that it's one of those diseases that is so invisible until the end, right? And at that time it's too late. Oftentimes when women are diagnosed, it's really because it becomes visible, right? And society ultimately ends up digging a grave for that woman. And so if we can address the invisibility of it now, maybe we may not be sending a lot of women to their graves at the prime of their lives. So how do we make it more visible is one word I would use.
Yeah. Right, absolutely. So, Dr. Juliet, what is the For Girls by Women? And can you tell us a little bit more about the program, why it started, and what you hope to accomplish?
I think you did a good job of sharing the website, but I'll be the first to say I had no business doing cervical cancer research. My work as a researcher is implementation science. In general, I am interested in how you sustain evidence-based interventions in resource-limited settings. And my partner in crime is Dr. Ezechi over at Nigerian Institute for Medical Research, and as well as Dr. Joe Tucker over at University of North Carolina, Chapel Hill. Dr. Ezechi is an OBGYN who had a vested interest in addressing cervical cancer. He's been doing that for a long time in Nigeria. And, we were just persistent trying to, work with the Nigerian Institute of Medical Research to address all the other issues it addresses. So my work with NIMA was HIV. And so we were just thinking of other things to do. And Dr. Ezechi insisted that we include cervical cancer as one of those other things to do. And so right around 2021, I did not know cervical cancer was in my house. I was just going along to address cervical cancer problem in Nigeria. And really the day after we submitted that first version of the grant, I still remember it. The next day was when my sister-in-law sent us a copy of her scan from the hospital. And ironically, my husband and I were celebrating my daughter's birthday. And when we pulled it up in private, he's a man, he actually started crying, and I still didn't know what was happening. And long story short, she was diagnosed with stage 2B cervical cancer at that time. And so we were thinking it was something we could still fight and address. And this was June. And so by the time all the care and everything started and we started giving her attention, turns out it was actually stage 4. The staging was not proper in the first phase. And within 3 months of that first news, she was dead. And so if I was not thinking cervical cancer was in my home, my sister-in-law, Angie, really brought it to life for us, partly because she did not disclose this until it was too late, which is typically the norm in many African settings, where by the time you find a woman with cervical cancer, it's often too late to do anything. And we tried everything. I mean, I cannot begin to describe what we did to combat this issue. We even had friends coming all the way from the US to Nigeria to see her, and all of it was too late. And so I think it got us realizing that we could have done more. Obviously, she never disclosed because of the stigma with the illness, but we could have done more. And one thing we could have done was prevention. Nigeria as a country is not equipped for treatment. I know that firsthand. There are only 9 centers where you can begin your chemo and go through that process. And for a country of over 200 million, that's not going to get us where we need to go. But we can prevent, right? There is HPV vaccination, there's HPV screening, and we can start now with prevention. And that's what For Girls and Women is trying to do, to begin the work necessary so that there will be no more Angies. It's a laudable task, a world where there's no more cervical cancer. But we believe that if we start working with girls and women who are the mirrors of the society, we can get to the bottom of cervical cancer. So thank you.
Wow, that's very touching. And honestly, you've given us a lot of things to think about. But I just wanted to point out on the website, we shared that nearly 8,000 Nigerian women die from the disease yearly. And we can see that like this is home, it affects everybody. You've shared your own personal experience, but we'd like to know, why is it the case that there are many evidence-based interventions, but we still can't prevent this?
Kiki, do you want to take that?
The question, did she say there are many evidence-based interventions and we still can't prevent this?
Yeah.
Well, to be honest, I feel like the major problem, and I'm going to talk about Nigeria because this is where I'm based and that's where I have more information about. I feel like the major problem is trying to get information out there. You'll be so shocked. Like you think that information maybe doesn't get across to like the rural areas or to the lower class, but you'll be so shocked to find out that women like you and me who are highly educated and who should know better do not screen for cervical cancer. You'll be so shocked to hear. In my industry, I've had conversations with women, highly intelligent women, very successful women who I thought should know better. And the minute I mention screening for cervical cancer, they will tell you that they never have. So in some cases, it's an information thing. Many people in the rural areas or the lower class people, they don't have access to information. There are many people in Nigeria that can't even afford 3 square meals a day. Trust me, trying to screen for cervical cancer is not the most important thing in their lives or the most important thing that they're thinking of at that point in time. So for some people, it's like an access to information. But for some other people, the women like me and you that I spoke about, I don't know, maybe there's just that whole thing in Nigeria where people feel like, oh, God forbid, it won't be my story. God forbid, it's not my portion. Because how can you be an educated woman who knows what is possible if you don't screen for cervical cancer, and who knows that this is like the only preventable cancer if you screen, and you still don't do it? Why? What's your excuse? When you talk to them, they have no excuse. They just don't screen. So there are several reasons, I would say, why this still hasn't been put to bed.
If I could piggyback, I think, like you said, 28 women before the end of today will die from something we could have prevented, right? Just hold on to that number. These are women at the prime of their lives. And so if they have children, when they should be getting their children to secondary schools or even their university, they're no longer there. And that's powerful, because then by the end of the year, 8,000 of these women will be gone from something we could have
That
prevented.
could have been prevented.
Something that could have been prevented if only they screened. Or take it back to the other side, if only they vaccinated their daughters. Right? I think me and you were having a conversation about vaccines.
Yes,
1 in
about
7
vaccines, yeah.
Nigerian girls, just count, 1 in 7 have not been vaccinated for HPV. Again, if you don't want your daughter to grow up in a world where cervical cancer exists, you want to vaccinate her early. Most girls are not
Well,
vaccinated.
you know how we spoke about information, right? So people like me and you, we try to get the information out there to let people know that young girls who are not yet sexually active, who haven't yet been exposed to HPV, which is the causative agent in a lot of cases, you know, that they should get vaccinated. We try to get the word out there. But many people in Nigeria are still very skeptical about vaccines. You meet people who haven't even vaccinated their children against things like measles or yellow fever. They're just skeptical about vaccines. So in that case, something like cervical cancer, that's the average Nigerian will say, God forbid, is not my portion. You can appreciate how they might not be in a hurry to, you know, vaccinate their children. So the task, one of the tasks that we have ahead of us is to try to get them to, you know, just eliminate that bias and make them know that vaccines are actually safe and that vaccines work and vaccines are beneficial and crucial, you know, to the well-being of their children. So it's a Herculean task that we have ahead of us, but it's something that needs to be done.
I agree. You want to share a little bit about your experience vaccinating your daughter? You shared that with me privately. What was that like?
Yeah, I mean, so because I know that I mean, people like us, we weren't lucky enough to have vaccines at the time that we were 9 or 11 or whatever. So now that we know that these vaccines are available and that if you vaccinate a girl, some people say 9, at age 9, some people say 10, 11, you know, whatever the case, before she becomes sexually active. We know that it greatly decreases or maybe even totally eliminates the chances of her coming down with cervical cancer. So if you have access to that information and it's something you can do for your child, why not? So I had my daughter vaccinated at age 9. She had 2 doses because at the time that was what was recommended. I think you said something about even 1 dose is preventive now. I mean, that's fine. So yeah, she had 2 doses. And I had the vaccine myself, even though some people will say it's less beneficial in people who are already sexually active, you know, but it still has some kind of protective effect. So I had the vaccine myself. I had 3 doses, if I remember correctly. But what I do in addition to that, obviously, is to screen. I know screening once every 2 years, once every 3 years is recommended. I screen every year. Yeah, I know it's not very necessary to do it every year, but I do it every year.
Yeah. And so to piggyback, in the past, it used to be 2 doses, the bivalent, but now there are 2 trials. I believe the Doris trial and the Kenshi trial that have made it possible that even having a single dose of HPV gets you further than no dose at all. And
at all.
I don't know if the country is ready to move into that single dose, because if you look at what exists by way of documentation, it's still recommending 2 doses. And this was before the release of those trials last year. So I think with more information coming out about the strength of single dose, I can see the country moving towards that, where if you do nothing at all, give your child 1 dose, and hopefully that protects her from something as preventable as cervical cancer. And like you said, the screening, again, recommendation is every 5 years, actually. But you know,
well, in Nigeria, they preach, we preach every 3 years in Nigeria.
Okay, fair enough. Fair enough. Yeah, I think the key is to screen, like you said, right? You know, if you know that this thing exists and you want to get to the bottom of it, the key is to screen, or vaccinate your child. Yeah, I agree. I've been screened. I think it's part of the routine here in the US, that especially when you're being pregnant, they would screen you, you know, normally for it. So I have been screened as well.
Okay.
Yeah.
Okay.
You guys have said like very interesting things, and I'm actually learning a lot. It's nice to know and to understand, in the context of Nigeria and what's obtainable abroad. But I would also like to ask a question to quote from the website. We said that girls and women hold a mirror to our society and can challenge conventional expectations about ways to end cervical cancer through crowdsourcing. Now, that's an interesting quote. So why do you need to do more as a society, and why involve girls and women? And, tell us a bit more about this crowdsourcing, Dr. Juliet.
Sure. So crowdsourcing is evidence, but evidence coming from the crowd as opposed to the experts. So if you, and this is now me going into the professor side of things, if you know anything about research, typically it's the experts that dictate what should happen, and then you funnel it down to the people and collect the data and make sense of it. Crowdsourcing, and which is what makes my project very unique, is that I actually have zero intervention, partly because I want the information to come from the end users. So if you think of what people normally do with any intervention or any outreach with cervical cancer, it's like you would set up shop and tell people to come screen or tell people to come do this, and then you pray to God people will come, right? That's usually the norm in anything, whether it's hypertension or HIV. But with crowdsourcing, what we are saying is we actually don't know what will work, because we want the information to come from the end users themselves. In this case, girls and women. If it's that everybody, and I can name all sorts of NGOs, even in Nigeria right now, some of them we're partnering with. Special shout out to George Carey Life Foundation, special shout out to Raise Foundation with the First Lady of Niger State, Dr. Abubakar Bello. So those are some of the partners we're bringing into this. They normally would do their outreach. They would go out, get people to screen, and tell them to come. And so what we're trying to say is, at the end of the day, women and girls, you guys are the mirrors of the society. And so, maybe for once our hands should be tied, and instead we ask you, what would you prefer? What would you prefer when it comes to vaccinating girls? What would you prefer when it comes to screening women? I don't know, because, it's a contest and we're hoping for the best ideas to come in. But when those ideas come, the goal is that our partners, myself, Dr. Tucker at UNC and Dr. Ezechi at NIMA, will work with you to go through a process called our Design-a-thon, so where you begin to design your intervention. Our boot camp, which is a month-long program that again infuses you with more information. You get to pilot test what you come up with, and then we get to see whether it leads to an uptake in HPV vaccination and HPV screening. In other words, this is an opportunity. If you've ever been interested in research, if you've ever been interested in even partnering with agencies like NIMA, if you've ever been interested in sort of understanding the backbones of research, how is that being done, and how can we use data to inform change, it's your opportunity, knowing that really it's, and even when you think of who judges this, right? It's not us, the researchers. We're going to leave it up to a panel of judges to tell us what works best. But our goal is to guide you through that process so that when at the end you come up with a great idea, it is yours, and we would help you get it to people over time. And I know there are a bunch of my partners here on the ground, but that's crowdsourcing in a nutshell, basically saying we need to redirect or reimagine interventions for people by people, right? If interventions often come down from the expert, but this time what we want is bottom-up interventions that come up from people themselves, impacting other lives. And your question about mother-daughters, I mean, any mother, any daughter that's on the call knows that that's a very critical approach for dialogues, for conversations, for communication in our society, right? There's no daughter that would not run to her mother when there's a problem, and vice versa. And so we were trying to build on sort of that cultural expectations that already exist in our context, where it's a powerful relationship, one that then can be leveraged for good. When you think of the assets of our society, mother-daughter relationships are big assets. And so we want to use that as an entry point for health. I mean, you just heard Kiki share her experience of even vaccinating herself and her daughter. And so that's what we want to build on, that asset that is within our communities as is for change. I don't know, Kiki, what do you want to talk about mother-daughter relationships and why that can be used for health?
So, I mean, can you hear me?
Yes.
Okay. So, I mean, like you said, whenever a daughter has any issue, she runs to her mom. When a daughter gets like her first period, the person who's on hand to show her, what to do, how to take care of herself is her mother. I remember calling my mom, screaming for my mom the first time I got my period. So yeah, mother-daughter relationships are very precious. There's a precious mother-daughter bond. And when it comes to something like cervical cancer, we're talking eradication and all that. I mean, the reason why this contest is a thing is that we pretty much know that we don't have the answers. So this is like throwing it out there, for people to come up with possible ways that they think, cervical cancer can be eradicated essentially. And I mean, what better to capitalize on than, a mother-daughter relationship, bearing in mind that, mothers and daughters are also the two, people who would be prone to having something like cervical cancer. So yeah, if they can put their heads together and come up with solutions, then that will pretty much help us to eradicate this scourge.
Yeah, I completely agree. Yeah, my mother's my rock too. I completely agree.
Yeah.
Wow. Personally, I can't wait to see the brilliant ideas mothers and daughters are going to come up with. Like, I'm so excited. And I can't even imagine. They're just going to be thinking outside the box, things we've never thought of, right? So this is going to be amazing. All right. Dr. Kiki, so I just want to ask, in your professional experience and in your personal life, I'll just say, has that changed, your outlook about cervical cancer and HPV? Your professional.
Well, in my personal, I want to say personal life, because professional experience, of course, I've seen so many women, with the disease. But truthfully, when it hits close to home, like when you actually know somebody who has died from this, then it's different. One thing I think I have a very big problem with in Nigeria is that people tend not to talk about the things that they're facing and the things that they're going through. I have an auntie who died sometime last year. She was bleeding postmenopausally, and she didn't really say anything to anyone, essentially. I think she mentioned it to someone who just brushed it off, but she didn't actually say it to the people who could have helped. And unfortunately, by the time they figured out what was going on, it was too late, and she passed. In her case, I think it was actually uterine and not cervical, but I mean, if the intervention had been done earlier, then maybe the outcome would have been better. So things like that hit close to home, because if she had even mentioned it to me, I mean, she's my auntie, so it's painful. It's painful because almost on a daily basis, or as often as you can, you're out there talking about this thing, talking about how women should get screened, talking about how this thing can be prevented, talking about how it's basically the only preventable cancer. And if you screen and find out that this is going on, then it can actually be taken care of. So to have someone close to you actually go through something like that and die when it could possibly have been prevented, yeah, that's really painful. So for me, that is the experience. I feel like, okay, I've been shouting and talking about this, but it appears that I have to do more, because people who have, certain symptoms that they ordinarily shouldn't be having are still not talking to the right people or doing the things that they are supposed to do. So for me, the way it has changed my outlook is, okay, I've been talking about it. I've been an advocate for it, and I've been doing advocacy for cervical cancer, but it's time to step it up, and do more, because it's preventable. There's no reason why any woman should have to die from this. Absolutely no reason. So that for me is my personal experience with it.
Yeah, I completely agree. Even in my sister-in-law's case, she did disclose to a matron, like he was almost like you said, they will tell people and people will give them some information and they won't share it to anybody else. And so I think we can do more. We can, this is why prevention becomes critical. We can do more to get the information out there so that, and I joke around, but if there's one cancer you should get that we can address, it's actually cervical cancer.
Yeah, because
So many
it's
of other cancers are
preventable.
horrible and there's really no solution, but not cervical cancer. And we can get to the bottom of it if only you talk and talk early. And so there is stigma. I mean, for sure, there's stigma around why is a woman still bleeding, right? If she's past menopausal, like in your auntie's case, there is that stigma, but it's not normal for a woman past menopausal to still be bleeding. So talk and share that, and you'll be surprised the solutions that might come your way. And I think that's what we're trying to do here, to ensure that women sort of have that avenue to share their concerns, to talk amongst each other, to share their experiences so that we don't have another aunties or sister-in-laws dying from something we can address.
Honestly, I think the first thing we need to do is try to work to eradicate this stigma. This stigma is the reason why they don't speak up, because if they do speak up, they can get help. But there's that whole stigma, like they just don't want to talk about it for whatever reason. And, you just go through something like that for years on end until it's too late. It's sad.
Exactly.
So yeah, we need to do more in, in the area of education about that stigma. It's nothing to be ashamed of. If you have a problem, you speak up and you get help.
I agree.
It's nothing to be ashamed of.
I agree.
Mm-hmm.
Yeah. Oh, I agree too. It's we have a lot of challenges facing us right now. But my concern, and is like one problem I've noticed in my years of practice, and it's really critical, like for any program in any region of Nigeria and even in Africa generally, we have the issue of sustainability, continuity of what we are implementing. What are the plans for sustaining the For Girls and Women program, Dr. Juliet?
I laugh because it is my area of expertise, right? So when I introduce myself, I call myself a sustainability researcher. In other words, and this is from years of training where I believe that if you have no plans to last, then you should not even start an intervention. And so the plans are multifaceted in the end, in the sense that there are key people that we've partnered with, people like Kiki, people like Nigerian Institute of Medical Research, key people that are going to be there long after this project ends. NIMA did not start today. NIMA, even Dr. Ezechi has been there for, I think, close to 20 years now. NIMA did not start today. And NIMA is an agency within the Federal Ministry of Health. And so everything we're doing with this work is intentional to guide NIMA's response to how we begin to eliminate cervical cancer. But then there are key influencers, people like Dr. Kiki Omili, who are going to be there with us, long after this project ends, and it will not end, because so long as there's cervical cancer, we're committed to remain to address it. There will be learning we'll be doing across the years. So if this is our first year and our first entrance into Nigeria in terms of how we might promote HPV vaccination for girls or HPV screening for women, subsequent years, there will be lessons learned in terms of what we did right this year, or what we didn't do right this year. And so there will be learning along the way. In other words, there'll be more contests each year along the way to get us to ensuring that we're doing what girls and women actually say they want. And then if those learning means things should be done differently, there will be changes along the way. So if we have to adapt the way we're working, if it's not working, I think we're open for adaptation. And finally, some aspects of us will work. And so in other words, the design-a-thons, the boot camps, some of our assets will remain along the way. I say all this to say there is a plan. It includes people, includes learning, it includes the changes we're willing to make, because real programs, especially things done in real world settings, require you to be willing to change as you go along. And then it also requires to nurture what works. And so we have a plan in place in the sense that we intend to remain for as long as this issue is a problem. We have great support from the National Cancer Institute, which is the funder of this work here in the US. They are very much vested in working with us to get to the bottom of cervical cancer in Nigeria. And so long as we get support from Nigeria, we get support from everyone on this call, I want to believe that that we will continue to ensure that for girls and women isn't just something that is fleeting, because if it's fleeting, then why bother, right? Our plan is to remain so long as cervical cancer is an issue. And so it's intentional with the naming. We're for girls and women for a reason, knowing that this project first belongs to girls and women. And so long as there are girls and women everywhere committed to becoming empowered to get to the bottom of cervical cancer, this platform exists.
Yeah, I like how you talk about partnerships and how you're pointing out that we need support from everyone. So all hands need to be on board. So Dr. Kiki and Dr. Julia, please stand by, but I want to ask if Dr. Ezekwo is available and pass on to him to talk about his personal experience with his sister. Hi, Dr. Ezekwo, are you?
Yes, hi, can you hear me?
Yes, thank you for joining us.
Sorry, I have to quickly come out of here. Give me a sec.
No problem at all.
Hello, can you hear me?
Yes, loud and clear.
Yes, hi everyone. Good evening in Nigeria and good morning. You guys took me unawares. My name is Dr. Chizoba Ezekwo. I'm a neuroendovascular surgeon here at St. Louis, Missouri in USA. And I am grateful that you guys are having this discussion because it's centered around the illness that took the life of my only sister. I don't want to put it lightly, but after I got I received the news from her the first time that she was diagnosed, and the impression I got was that it was stage 2B, that it hadn't spread far and wide and that it could be contained. Somehow being a physician myself, I knew that at that stage we could rally around and take care of the illness. I got, Dr. Ezechi happened to be a family friend of ours. So I called him and, knowing that he's an expert in the illness. And his opinion was that since she's in Jos Plateau State, that he would connect me with Dr. Musa. He's a professor at the Jos University Teaching Hospital. I called him up, very nice, warm personality, and he agreed to take up my sister's case, and he started afresh, trying to stage her again. And he was the one that broke the news to me that she was already stage 4 at the time he saw her. And you could imagine how that made me feel. While this was all going on, my mother lived with us, and I didn't know how to break the news to her. The plan we had was to see what we can do to, bring my sister over here for treatment. I got in touch I had contacts in MD Anderson in Texas, one of the best cancer institutes in the world. And we were making plans to actually get her to the States, even though I know the prognosis is slim at that time, given the stage of her illness. And she gradually just kept going down. We moved her over to Lagos. Cut the story short, eventually I got woken up at 3 in the morning one day through WhatsApp text message from the hospital where she was, telling me that they are sorry, they are sorry that may her soul rest in peace. And this was just how the news was broken to me, through text message. And they sent me the bills, the final bills for the hospitalization. You can imagine how that made me feel. I called the number that sent me the text, and they were surprised that I wasn't aware. I guess the lady did not know the time difference between the US and Nigeria. And I called my brother who was there with her, and he confirmed the news. And by that time, knowing how she was, I had told my mother that she needed to go to Nigeria. that my sister was asking for her. And then she's like, she calls her on the phone, but she doesn't respond. It was because of the illness. We took away her phone from her. We didn't want my mother to get in touch. We wanted her to see her. And she was able to see her while she was still alive. And imagine traveling from America to see your daughter, your only daughter, in a hospital bed. The last time you saw her, she was completely different. And you know how emaciated she was. She looked so differently. And being a mother, seeing your child in that situation, that broke everybody's heart. And my sister happened to be the only one I had. She was our eldest. And she passed away that way. One of the things that we didn't put, one of the things I want to address, to tell you, especially the young ones, the ladies in the call, is as much as cervical cancer is a hidden disease and easily preventable, not paying attention to it can cause devastation for not just the person with the disease, but the entire family of the person. My sister had an 11-year-old daughter, and she had to lose her mother to this illness. So we resolved, and I appreciate Professor Juliet Iwelumo, who took it upon herself to never allow this happen again to someone she knows, including people from Nigeria and Africa as a whole. And I'm very grateful that the memory of my sister will remain in the heart of many people, as she participates in the projects that they embark on for this program. Touching more on how medical practice in Nigeria goes, there are so many aspects of it that needs to be addressed, not just that someone had an illness, but how to prepare the family for the news of the inevitable and how to engage family from the beginning with the goal of making sure that everyone is ready. Nigeria, I don't know much about the practice of medicine in Nigeria, but I doubt if there's anything attention paid to palliative care, to hospice medicine, the way it is done here in the US. If this a group of practitioners in Nigeria who took care of my sister had a little training in palliative medicine, I'm sure that breaking the news would be done in a much more humane way, especially sending me bills at the end, without even, and using text message to break the news, like someone that the person is not a human being, but I know that it's not the fault of whoever did it. It's just the way the system was set up. So I thank you very much. And I hope that I have been able to, give you information regarding why this project matters a lot to me and my family. Thank you very much.
Wow. Thank you so much for sharing that personal detail with us. Obviously, we have a long way to go in Nigeria, and I'm so sorry that you and your family had to go through that. It's a very painful experience that you would not wish on anybody at all. Dr. Julia, do you have anything you wanted to add?
No. I mean, I as being on the other end of it too, that's why prevention is critical. Even the bill for treatment, I think we're talking about centers. There are only 9 centers in the whole of Nigeria where you can maybe get in line. I know Dr. Matilda Carey is on the call. Maybe she can elaborate on that. The resources for treatment are just insurmountable. Hence why we need to begin in the prevention side of things. Matilda, are you able to speak? I know I'm putting you on the spot. So sorry. Otherwise, no worries. And I'll turn it back to you, saying that we need to do more with prevention, knowing that treatment is insurmountable in many cases in Nigeria.
Yeah, absolutely. All right, so one final question for Dr. Kiki and Dr. Juliet. What piece of advice would you give any girl and woman interested in participating in this?
Kiki, do you want to go first?
No, I think you should go first.
I think come is the one thing that we would say. No idea is too big, no idea is too small. I am cognizant of the fact that my sister-in-law didn't have social media at her platform as a platform. In other words, maybe she used WhatsApp, but she didn't have access to high tech. And so if you know a better way of reaching women who we typically tend to forget, come bring those ideas, because you'll be surprised where that's what we probably need more than high-tech solutions, because we need to, everybody needs to be informed, everybody needs to be involved, and no idea is too big, no idea is too small. So please join the contest and share your ideas.
Okay, so I would say, obviously, we need help. If we had all the answers, women would still not be dying of cervical cancer. So we need help, which is why we're asking anyone who is interested to please come forward with ideas. And who knows, your idea just might be like the best thing since sliced bread. If we execute this, if we execute this, who knows, you could just be saving like a ton of lives. So yeah, this comes through.
Amazing. Thank you so much, Dr. Juliet and Dr. Kiki. But we'd like to go to some frequently asked questions. We've been getting some questions and we're hoping that you can address some of them for us. Who is eligible to participate in this open contest?
Every girl and their mother, right? 9 to 15, I think we said for the girls, and 30 to 65. So everyone that can form a team of girls and women is eligible to participate. Nigerian girls and women, no.
All right.
Yeah, so by this you mean it doesn't have to be a mother and a daughter, it could be a niece and an auntie.
Right. So the word mother is loosely defined. So long as
it's loosely defined, okay.
Right. So long as you're a caregiver, you mentor a girl. So like my sister-in-law's daughter is, her mother is late now. So you might be a stepmom, any of that situation is okay.
All right. Nice. So can you just give us a little tip, like what kind of ideas are you looking for?
I think reach, the name of the project technically is called Access, right? The fact that is almost like everything we said, girls and women do not have access to information. How might we increase that? And so think of the woman, whether she's rural or even educated, right? Dr. Kiki talked about that. It's not just the uneducated, it's even the educated. Access to information is so limited that we're calling on you now to give that information. So think outside the box is our slogan. Be creative, be innovative. Think of what we normally do in our cultural setting. You don't have to be appealing to anybody in the West. Do what works best for Nigeria. Build on the assets that we know work best in Nigeria and tap into it. I think I love Chinua Achebe quote where he says, until the lions begin to tell the story of until the lions begin to tell their own stories, the story of the hunt will only glorify the hunter. So in other words, be like a lion, tell your version of the story now. So we don't only hear the other perspectives. If it's that the other perspectives have been very medical or very expert driven, it's time for the lions to step on the stage and tell their version of the story, because that's what we need more than very, expert driven ways.
Thank you for that tip. I'm sure people on the call are glad they're here. At least they've gotten, something to think of when they're putting in their applications. Please, if you have any questions, type them in the chat. We'll get to them. Dr. Juliet, so what if my idea wins? What happens next?
Oh, wow. It's a series of steps. So you move into our boot camp. It's a 1 month long process where you'll be paired up with folks like Dr. Kiki and so many other folks that are coming along with us for the journey. Pinpoint Media, for example, is a partner. Pinpoint Media, Chrissy Heder was the executive producer of MTV Sugar. So he's coming along for the journey. Matilda Carey is also along. We have support from the First Lady of Niger State, Dr. Abubakar Bello. I mentioned that earlier. So there are many people coming along that will mentor you along the way. And so The key is to come along. Chisom Obi-Jeff is another person. I don't know if I mentioned her. She's worked a lot with Gavi and trying to make access to HPV vaccines accessible to Nigerians. And of course, we have Dr. Ezechi and the whole onslaught of NIMA guiding us, Dr. Titi, Dr. Agatha Wampok, many people from NIMA are really guiding us along this way so that we can really get to the bottom of cervical cancer in Nigeria.
Wow, I didn't know this much people were going to be involved. It even makes it more exciting. Wow. So we have some questions from the chat, and someone asks, Peace, can friends of the same age group apply? Example, classmates of girls?
So long as there's a mother figure involved, because it's not just the vaccine. You always want to keep in mind there's vaccination and screening. So it's both vaccination and screening. And so as you're forming the group, keep in mind we want the vaccines, and keep in mind we want the screening as well.
Okay. And for clarity, what's the age group of people eligible to participate?
For screening, we've opened it up 30 years old to 65. Initially, it was 30 to 49 following the WHO, but from comments that came actually from constituents in Nigeria, we've opened it up to 65. For the vaccines, we wanted 9 to 15, partly again because of recommendations from WHO. I think we will be flexible so long as there are great ideas, form teams as you see fit and send those ideas. Again, this is not rigid in the sense that our hands are tied. If your idea is going to be the game changer, that's what we're looking for at the end of the day. Mm-hmm. And let it ensure that idea is targeting vaccination and screening.
I see. Thank you for that clarification. Well, there seems to be one question that keeps popping up. And please, can you clarify if you have any other way?
Before I do that, I believe Dr. Ezechi might be on the call. Oh. Sorry. Dr. Ezechi, are you on the call too?
Yes, I am.
Okay. That's our big boss from the Nigerian Institute of Medical Research. This is his passion project, cervical cancer. I started by following him as a mentor of his, and maybe I'll open it up for you to say a few things, Dr. Ezechi.
Thank you, everybody. This is for girls and women, by girls and women. So I'll stay in the background and let the women and girls talk.
Okay, no hala, thank you. We're thankful for the support of the Nigerian Institute of Medical Research. Thank you.
Thank you. At least we know men are our allies.
Yes,
so thank you.
yes.
All right.
I was just going to say the men are very important in the process. So, I mean, the men are important for moral support, you know.
I agree.
Exactly. That's what I'll be doing from the background.
Thank you.
Thank you. We really appreciate that. Okay, so back to that question that keeps popping up. I want to apply with my friend. Is this acceptable? Yeah,
and then maybe you want to share the website so that people can see more contest information. And so some of the frequently asked questions are also there. I say, again, so long as there's a mother figure in the team that can do the screening and there are young people that are paying attention to the vaccination, it's allowed. It's just not only, you don't want to form a team that's only into vaccination alone. It has to be both vaccination and screening. So consider your team as who's the vaccine people, who's the screening people. Does that make sense?
Mm-hmm. It does. Thank you. All right, so we have another one. What modality are we submitting our pitch? Is it in form of a PowerPoint or a Word document or a video?
Great question. Again, the link to the website, which we can put on, which if you want to put it on the chat, gives you different modalities, whether it be an essay, whether it be video or audio. We're flexible. You tell us what works best and we go from there.
Right. Oh, Dr. Julia, there's this question. I got a clearer view of the program from the webinar. Can someone reapply?
Dr. Ezechi, what do you think?
Please, can you repeat the question again, please?
I got a clearer view of the program. Can someone reapply?
Please do. once you have great idea, that one we are looking for. This is not an examination, but something to improve the quality of care we give to women and girls. So please do.
You got it.
Oh, thank you. You made somebody very happy, I'm sure. All right. So someone says, what about age 16 to 29 years? Are they not included?
It's a good question, and they are. Again, those are some of the changes we've made. They are included, is what I would say, and leave it there. Dr. Ezechi, do you have anything? I mean, according to the SOGON guidelines, in terms of Nigeria's own criteria, it's allowable as well.
We are very flexible. We just want to provide solution to a disease that's killing our women and girls. And anybody who can provide that solution, irrespective of the age, please, we welcome the idea.
Okay, so you've heard that. Thank you. And then we have how many group of people can be in a team?
4 is what we said. But again, you heard Dr. Ezechi, we are very flexible.
All right. So I think this takes us to the next question. Is it just one idea or series of ideas?
I think you want to package it as a cohesive unit because you're only sending in one thing, right? And if it's that, and you think of a storytelling, if it's that there's a beginning, a middle, and an end, put that all together as one package and send it in.
Okay. And someone would like to know if my idea isn't picked, we will get an email back to tell us it wasn't.
Absolutely, absolutely. And stay tuned. Again, this is year 1. There will be more contests. There will be more opportunities. Again, we are here so long as cervical cancer remains a problem in Nigeria, and Dr. Ezechi will be the first to say, we are committed to get to the bottom of it. Our vision is a world where cervical cancer does not exist, and it's a whole village approach, not just even city or town. We want everybody involved to help us get to the bottom of this. And so even if you don't make it this year, there'll be more opportunities along the way with the For Girls and Women group. Naima is backing us. Amen.
That is good to hear. And we have a question. Someone says, does that mean the team should comprise of some people working on the screening aspect and the others working on the vaccination aspect?
Absolutely. I mean, the format should always consider the mother and the girl. Does that make sense? So think of that as a complete whole for the mother. And that you heard Dr. Kiki share her experience of vaccinating her daughter, but then even vaccinating herself and still screening. And so think of that unit as a whole. How might you get the mother and the daughter to do this together?
Before we go back to the questions, we're going to put a link. If you're interested in being a part of our raffle draw, please kindly click on the link and submit your details. And you might just be the lucky person to win a prize. Oh, we have something nice. This is not a question, but Adetokunbo says, greetings and sincere appreciation for your good work you're doing in the fight against cervical cancer. God bless you. I don't have a question, but I just want to make some contributions. I heard this kind of talk about 15 years ago, and I was privileged to be part of it, to be part of a screening exercise. I think it's not just stigma preventing people from speaking out, but also the cost of the intervention as well. So this should be taken into consideration. Also, women can be more effectively reached as groups rather than singly. They open up better, and an outreach is great. Thank you.
Absolutely. That's why we're thinking of groups. It's not an individualized approach. It's a whole hands-on deck approach. I agree.
All right. Oh, and we have one. Can a male be part of a team? I believe their support can be great.
Dr. Ezechi, what do you think?
Well, you can give a support without being in the face. Just support them from ideas.
Behind the scene, yeah.
Remember, Julia, when we were I-Test group, we had a team that 2 or 3 people were in the camp, but 1 or 2 others were remote, working from the One was working from Ghana, one was working from Ibadan. Why the other way? You can work with them remotely.
I agree.
Yeah.
So be their backbone, be their
Be the
foundation.
backbone.
Yeah.
We didn't want anything. We all know that when cervical cancer is a condition of the genital organ, female genital organ, and because of our culture and issues surrounding it, there is issue of a bit, cultural influences making people not coming up with issues. So we don't want something that will make it for the women not to be open to talk or to come out with it. So we just why we want to focus it on girls and women for girls, and so that the issue of being shy or coming out to make will not be there. So that's why we don't want men to be in front, but supporting from behind.
Thank you, Professor Ezechi. That was very helpful. Dr. Juliet, back to eligibility, it seems to be like an issue for a lot of people. So someone is asking, if members of a team are above 18 years, do we still need a mother figure as a member?
Again, so long as you're thinking for the duality's sake, that screening, right, the 30 to 65 and the vaccine, who are you, who's addressing that for your team? That's what we're looking for at the end of the day. All right.
Okay, I hope that clarifies this question that keeps popping up. Yes, I can see some people are having problems opening the survey link. We're trying to get that worked out. However, you can put your email into the chat if you would like that. At least we can know you're in attendance, and we'll still do a random pick for someone. Does anybody have any final questions for us? Oh, the survey link has been fixed. So please click on the link. Oh, we have a question, Dr. Juliet.
Yeah, medical professionals can join. Yes, please.
Okay.
And I know we are at the hour, so as not to keep people beyond what we promised. Maybe perhaps I can extend a big thank you to Dr. Kiki. None of this is possible without support. And so we thank you for coming on such short notice. Maybe, do you want to say a final word? And then,
well, yes. Yes, I want to say thank you for having me. Cervical cancer for me is something I'm passionate about because, like we keep saying, it's the only preventable one. So it's something I've been speaking out about for a long time. My friend Matilda Carey of the George Carey Life Foundation is someone who does a lot of work with cervical cancer, and I try to support as much as I can. So, of course, I'm glad to be here and to lend my support. So thank you for having me.
thank you. Same thing. As long as this is an issue, we're here. So please support for girls and women wherever you see us. And I thank you all for coming. I thank you, Ifeoma, for hosting. I think this was amazing. If you want to say a final thing and then we wrap up, please.
All right. Thank you, everyone. Thank you, Dr. Julia. Thank you, Dr. Kiki. And thank you to Dr. Ezechi. It's been great having everybody here. I've learned a lot, definitely. And we're looking forward to reading your applications and your ideas, and go creative. All right. Thank you.
Thank you, everyone. Thank you. Feel free to reach us if you have any questions.
Ifeoma, you did not thank me. I did
Thank you.
Thank you, Dr. Ezechi.
Thank you, Dr. Ezechi.
Thank you, Dr.
fine.
Ezechi.
Thank you.
Yeah,
Thank
Kiki,
you.
how are you?
I'm very well, thank you.
Good to see you. Yeah.
Good to
Thank
see you
you.
too.
Yeah.
Bye-bye, everyone.
Bye.
All right
Please
then.
help
Bye.
us to
Bye-bye.
to
Thank you.
spread it far and wide.
Sure thing.
Yeah.
I'll do my best. I'll do my very best.
Okay. Thank you.
All right then.
Bye.
Yeah, bye.
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 Bye. Keep up the good work.